This is the Hall Institute's forum. My name is Michael Rickards. Today I have two distinguished colleagues with me. One is, of course, known to you from our previous shows, Richard Lee, our Director of Communication at the Hall Institute. And the second is our guest, David Knowlton, whose name is also familiar to many of you. He's the President and the CEO of the New Jersey Healthcare Quality Institute. David, welcome. We're glad to have you here today.
Glad to be here, Michael.
You've had an interesting career. Tell us a little bit about you and how you've come to this present position.
Well, it has been an interesting career. I started out, I came to New Jersey to work in lobbying, worked representing optometrists for a while, and then I ended up at the Department of Health as Deputy Commissioner under Tom Kane's administration, and then formed the Healthcare Payer Coalition that was representing all the independent payers in the state, and we spun off a quality institute to pay attention to healthcare quality, and that's how I got involved in my current slot, which is a foundation really to worry about access, quality, and safety in healthcare delivery.
Your organization now, I know, has a number of initiatives. I looked on your website. I wonder if you could maybe tell us a little bit about them. And I was particularly interested in the Mayor's Wellness Campaign, because we're here in Mercer County, and I believe Hamilton Township was one of the first, or if not
one of the first healthy towns.
Yes,
that's right.
Yes.
We set up the Mayor's Wellness Campaign to give best practices to people so that they would be able to make decisions about what could keep their communities well. And you know who loves it the most? Our real estate agents.
Really?
Because people really do purchase places to live based on whether it's a healthy lifestyle. It's encouraged. And so we've started the Healthy Towns that make a commitment to doing specific work to improve the wellness in their community. The first one in the state of New Jersey was Madison, New Jersey, and the second was Hamilton Township, and where we're sitting right now, I believe.
Great.
So it was. It's been a very successful program. Our other programs are about healthcare quality reporting, so that people can look up who the best doctor is, who the best hospital is, and get that information on our website and make a decision about their healthcare.
Great.
Madison, that's my hometown.
Yeah, Madison was number one.
I didn't realize they were into that.
Yeah.
Oh, it's good. It's good to hear it. What type of findings have you had in this very explosive issue that people have raised concerning the quality of care in hospitals and the feeling that a lot of post-operative infections are due directly to the hospitals and to the fact that they're just not hygienic environments?
Well, I think that's somewhat a simplistic view. I think there is an exploding amount of hospital-acquired infections. But what's really happening is people are living longer. People are more likely to have cancer, and they're on immunosuppressants, which makes it easier for a bug to get a foothold. We've been using antibiotics for a long time now. You even have it in our soaps, and so people get antibiotic resistant very easily. And so I would say that we have to be even more diligent because of the changing environment, rather than say that I don't think the hospital has been negligent. I just think it's a huge problem because of the nature of the care that's delivered. But it is a big problem. We lose lives every year because of a hospital-acquired infection.
Now you're involved with the Leapfrog project.
I'm on the board and I'm an officer.
What exactly is that?
Leapfrog was formed by the Business Roundtable, which was a large CEO leadership of large businesses, Fortune 500 businesses. And they were frustrated because quality was so low in healthcare and they were paying for it. So they decided to create the Leapfrog Group, and it was thus named because the concept was to leap over barriers to good quality. And they decided, this was right after the Institute of Medicine report, that said that 98,000 people died unnecessarily from medical errors. If you were to put all their names on the Vietnam War Memorial, you'd have to build 2 of them every year. That's how many names we're talking about. Or the one I use most often is when the TWA Flight 800 went down off the coast of Long Island, there were more people die every day from health care medical errors than died in that plane crash. So it's the equivalent of a jetliner going down every day. So the Leapfrog group said, how can we fix that? And they found that if we did three things, and they called them the three leaps, that we could eliminate 2/3 of the errors. The first was to have doctors enter their data and orders on a computer terminal that was smart enough to say, doctor, that's too big a dose, or I don't understand. The second was to ensure that the people caring for you in the ICU, the intensive care unit, was somebody with special training to do that. It's system-wide instead of just one part of you. Right now, attending doctors provide the supervision in the ICU. This required an intensivist that's called a special doctor. And the last is to say that they will only do a procedure if they can maintain certain minimum volumes, which ensures that the surgeon is skilled at doing the procedure. And those are the, and then the Leapfrog group started to hold people accountable for making progress on these particular objectives.
Is this a national initiative, or is
Yeah.
this okay?
It's national.
Okay.
There's been some evidence that some of those infections just are due to the question of hospitals not being cleaned much, floors and walls and even operating rooms.
Well,
Is that a correct summary?
Well, I can tell you, there was an interesting study that showed that the two most infectious things in the hospital room were the TV remote,
Right.
because everybody handled it, and it's hard to clean, and the doctor's necktie, because the doctor leans over the patient, the necktie gets into the field. And so it's a thorny problem. People are very worried about it, but it's a thornier problem. It isn't that people often in quality try to find what somebody's doing wrong, and it's almost always a system error. People aren't looking at the big picture. They're trying to look at the small picture. Well, someone should have done this or done that.
We're going to look at the whole question of the healthcare system when we return. We're going to take a break now.